Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the Next Gen podcast. We are initiating this podcast as a part of the Next Gen Critical Care Conference, which held in Riyadh, Saudi Arabia, 1st of February 2025. And the first guest for today, Dr. Chloe. Doctor, kindly can you introduce yourself for us?
Hello, my name is Dr. Chloe Joint. I am a neonatologist from Edmonton, Canada, and I work at the Stuttery Children's Hospital. Thank you for having me. It's been such an honor visiting your country and such gracious hospitality. It's been lovely to get to meet you.
You're welcome. Thank you so much for coming with us today in this episode of the podcast. So the first question I want to ask you, how is your daily lifestyle as a critical care consultant?
That's a great question, and it very much depends on the day. There are very busy weeks where I am doing clinical service, and during those weeks, you get up very early in the morning. I work with a great team, so we meet every morning to discuss patients that we all have in common. We make plans so that we can go back and speak with the families. Then I round again with another great team. And usually the days are quite busy. We have a very high turnover NICU. It's very specialized. So we see patients from not just our own city, but for 4 different provinces come to our particular NICU. Then I go home. I chat with my family and my husband, who is also an intensive care physician. We try and maintain a little bit of normal life. We have children who go to sports, help with homework.
Yeah, responsibility.
Yeah. And then because we both have administrative roles, we often will spend a lot of time afterwards answering emails, writing manuscripts, doing the other things that we do in addition to being a critical care physician. Keeps us busy, but it brings us joy, so it's what we like to do.
Nice. Any exercises during the day, special rituals?
I would like to say yes, but really every day is so different that we've just learned to be adaptable.
Nice.
No day looks the same.
Nice. The other question, because I'm a resident, so I want to ask you, if I have a time machine and take you back to the residency, what things would you do better or differently?
I think I would learn not to worry about the future so much. I think it's great to have a plan. It's great to have a goal. But as we were talking about, I think we need to allow ourselves the grace to be able to grow not in a straight line. And that's talking about when you are a resident, you see your future as being a consultant, and you feel like it should be a straight line, and you jump through all of these hoops because you want to get there in a straight line. But the beauty of medicine is there are so many things you can do in medicine and so many things you can do in intensive care. And if you allow yourself the patience or the time to stop and see everything in front of you, you realize that the path that hops across the stream on many different stones, as opposed to just swimming right across, is a path that will enrich your life, and therefore it will enrich what you can offer to patients. I thought I was going to be a clinical researcher. And I still love hemodynamics. I still love cardiac physiology and surgical physiology. But somewhere in there, I ended up being an educator and a program director. I set the national exam with a group of people. That brings me great joy. It's so fun to keep learning. Then I hopped to administrator and ran my NICU and worked with cardiac surgery and pediatric critical care and my other NICU colleagues to develop pathways. That was a part of my brain I didn't know existed, but I found great joy in not being a leader, but helping move everybody in the same direction, and found it kind of enjoyable to see conflict, but learn how to manage conflict. Made me a better physician. And now I'm finding I enjoy my curiosity in some of these international roles, going and seeing what places across the world are doing for their medical education. So I have jumped all over.
Yeah, you tried many things.
The stream, yeah. But each time I find something new that I didn't know I would love, and each time I think it builds me into being a better consultant, a better physician, to be able to bring all of this experience to my patient and family.
Nice. Thank you. Actually, you already answered that third question that I would ask, that about the pathway of in the medical field. Sometimes we thought that it's straight and we have a clear plan, and things doesn't go as we plan sometimes.
Yeah, and to not be hard on yourself if you fail. It's okay to fail. It's okay to learn you're not good at something. That's still very valuable. If you fail, you learn to pick yourself up and try again and learn from the mistake. And that is very valuable.
Good. That's very nice. Thank you so much for your precious time that you give to us. Thank you so much. These words are really important for us as a resident. Thank you so much.
Thank you.
You're welcome.